In today's demanding professional landscape, the mental well-being of our workforce is not just a personal matter, it's a strategic imperative. The challenge we face is threefold: providing support that is immediate, accessible, and consistently available. The opportunity lies in leveraging technology to bridge critical gaps in care, creating a more resilient and productive organization. This is the new frontier of employee wellness. Let's examine the market context. Globally, the need for mental health support is significant, yet a substantial help-seeking gap persists. Barriers like stigma, cost, and scheduling conflicts prevent many from accessing traditional care. Simultaneously, digital adoption has accelerated, with individuals increasingly turning to their devices for immediate solutions. This trend presents both a challenge and a clear opportunity for innovation in corporate wellness programs. This brings us to the solution landscape, which is broadly divided into two categories. On one side, we have automated digital tools. These include mobile applications, AI-driven chatbots, and libraries of guided content. Their primary strengths are speed and accessibility. They can provide in-the-moment support, 24/7, directly from an employee's pocket. On the other side is traditional therapy, delivered by licensed clinical professionals. This approach offers human expertise, deep contextual understanding, and the nuance required to address complex underlying issues. It is the gold standard for comprehensive care but is constrained by availability and cost. However, deploying digital tools requires rigorous attention to risk, governance, and ethics. Data privacy is paramount. Any solution must be compliant with regulations like HIPAA and GDPR, ensuring employee information is encrypted and secure. We must also consider the potential for algorithmic bias and, most critically, have clear, tested protocols for crisis situations. A digital tool must be able to reliably identify and escalate a user in acute distress to a higher level of care. It is essential to state that these tools support but do not replace licensed professionals. In any emergency, individuals should be directed to contact emergency services immediately. From a business perspective, the return sorer satsen safen satsen zarken sender. Owen datsen stralen Owens with fine statstor in retines. Ferterman is compelling. Digital tools can significantly reduce time to relief, offering immediate coping mechanisms that can prevent escalation. This leads to improved adherence to care plans and can positively impact productivity by reducing absenteeism and presenteeism. The cost-effectiveness of scalable digital solutions allows us to extend support to a broader segment of our workforce. Let's consider specific use cases. For acute, in-the-moment anxiety, such as stress experienced during a commute or following a difficult meeting, an app can provide immediate grounding exercises. For employees already engaged in therapy, these tools offer valuable between-session support, helping them practice skills and log their experiences. This data can then be shared with their clinician, creating a more complete picture of their progress and challenges. This leads to the optimal approach, a hybrid or tag team model. Here, automated tools and human care work in concert. The digital tool serves as the first line of support, offering immediate relief and skill building. When an issue requires deeper intervention, a seamless handoff protocol connects the employee with a licensed professional. This integrated system ensures that support is both immediate and appropriately matched to the individual's needs. An effective implementation roadmap is crucial. It begins with a rigorous selection process, vetting potential digital partners for clinical validity, security compliance, and user experience. The next phase involves integrating the chosen platform with our existing wellness benefits and establishing clear escalation pathways. A successful rollout is supported by a comprehensive enablement campaign to educate employees on the available resources and how to access them. To ensure efficacy, we must focus on measurement. Key performance indicators should include engagement metrics, proxies for symptom reduction, and employee satisfaction scores. We also need to track triage metrics, such as the number of successful escalations to clinical care. This data-driven approach allows us to continuously refine our strategy and demonstrate the program's value. In closing, the question is not whether to choose technology or human care, but how to integrate them effectively. We can use the speed and scale of technology to provide immediate support, especially in moments of acute need. An employee can use a guided box breathing exercise to regulate their nervous system. They can follow a 5 senses grounding technique to anchor themselves in the present moment, or engage in a quick body scan to release physical tension, all within minutes. Then, that data, what triggered the stress, what helped and what didn't, becomes a valuable asset in a session with a human professional. This hybrid model provides instant relief through automated tools and fosters deeper, lasting change, with a clinician who understands their journey. By embracing this integrated strategy, we can provide support that is both fast and personal. We empower our employees with the right tools at the right time, building a healthier, more resilient workforce. Let's take the next step to implement this vision.